Welcome to all Allium's partner. This time, we will cover the imperative Allium's treatment algorithm. With it, we will know how to better select patients for Allium stents, but without it, we will shoot in the dark and most certainly miss patients that are a very good fit for Allium. This treatment algorithm is built by both Allium and urologists, bringing unbiased experience that is aspiring to put the patient in the center. When surgery is preferred, it is of course mentioned and vice versa. This video is a recommendation, and of course you, as urologist, must take into account other factors and follow your clinical judgment. Hope you will have a fruitful session. This is the full treatment algorithm for ureteric malignant strictures. It is intended to show you when it is optimal or recommended to use Allium URS along the patient journey. Take a look at its structure. It is divided to intrinsic and extrinsic location or type of the stricture. Then what's the first action to take? In intrinsic, it's divided by short or long strictures and whether patient has low or high risk for surgery or short or long prognosis. After that come the recommendations for first-line treatments and second-line treatment in case of a treatment failure. In extrinsic, it is the same except size of stricture does not play a role as it is a compression stricture. Pay attention to all the algorithm's details. This is the full treatment algorithm for ureteric benign strictures. Overall, it is similar principle as the malignant one, but here short or long prognosis do not play a role as we're talking about benign, and it's only a question of low or high risk of surgery. We will now be getting into the depth of it. Before anything, as first action, you probably use a double J or a nephrostom for immediate drainage, and then ask the relevant questions in order to assess the case and decide on a further action. Let's take an example. In the image you are looking at, you can see an extrinsic malignant stricture. You first assess the patient. If he has a long prognosis or low risk for surgery, you will probably go for the radical surgery to remove the tumor and a definitive urological treatment. If you encounter after some time a thermal damage or ischemic stricture, Allium is the recommended treatment rather than repetitive double Js with less results. And for fistulas, Allium is optimal, as it's the only stent in the world that is approved for CE for fistula treatment and can practically seal the fistula immediately, unlike double J, and can cure it within 6 months. If patient has a short prognosis or high risk for surgery, Allium is also optimal, rather than repetitive double J. In relation to it, in this image you can see a real case of an 85-year-old patient with short prognosis with external pressure from tumor almost along the entire ureter, and the great results by Allium URS granting him full patency, normal drainage and quality of life. Let's look at intrinsic malignant stricture. This is a real case of a 72-year-old oncologic patient who refused radical solutions, showcasing an intrinsic cancerous stricture. The image above on the left shows the bilateral Cook resonance stents implanted, and the images right next to it show the ureter still had serious strictures after removing the resonance stents, and the patient still had a hydronephrotic kidney. The single image at the bottom showcases the immediately success of the Allium stent opening the lumen for another year, until unfortunately this cancer patient died regardless of Allium stent. Let's look at extrinsic benign stricture. This is a real case of a 76-year-old patient who had an abdominal aortic aneurysm, which is a localized enlargement of the abdominal aorta, the main blood vessel supplying blood to the abdomen, pelvis, and legs, such that the diameter is greater than 3 centimeters or more than 50% larger than normal. It pressured the left ureter. You can see on the above image the stricture caused by it after removing the failed double J next to the vessel graft, and the below image showcasing the successful Allium URS stent opening the lumen much better. There is still a narrow part because of the high external pressure, but with enough drainage. Last but certainly not least is the intrinsic benign strictures. The above image, case number 1, is a real case of a 49-year-old patient with recurrent stones and procedures who developed a long upper ureter benign stricture. The stent was correctly positioned on the new anastomotic stricture that was developed due to ureterocalacostomy that connected the ureter to a different point of the kidney, the lower calyx, without blocking urine flow but rather granting a great flow. Dr. Klein from Carmel Hospital in Israel says the stricture is resolved some good period post-removal thanks to Allium. The below image, case number 2, is from a 48-year-old patient with a mid-ureter benign stricture. This patient got a laser trying to open the stricture and a boriflap surgery, but instead the patient developed an anastomotic benign stricture in the UVJ. Doctor tried to drain the urine with an endopyelotomy stent unsuccessfully, and patient had hydronephrosis again. The thing that worked was the Allium URS stent that granted the patient a great drainage immediately in a resolution of the nephrotic kidney. In the middle image, case number 3, is a third benign case of a 67-year-old patient with a transplanted kidney with a stricture in the lower part of the ureter. The patient had a chronic kidney disease, so the patient either needed to find a kidney, which is a rare commodity, living with urine bags in quite a young age, risking the already very sick ureter with a reconstructive surgery that could lead to the loss of the transplanted kidney. An impressive patency in drainage was achieved immediately by Allium. It is crucial to pay attention to when Allium URS is either recommended or even optimal to use along patient journey in benign or malignant strictures, and when you can even achieve a curative effect in benign. Circles mark the optimal and stars the curative effect. So, apart from using Allium in second-line treatment, as you can see here in benign, consider Allium also for first-line treatment in cases of benign strictures in which you can achieve between 70 to 80% curative effect, depends on size of stricture and etiology within around a year, and can replace a surgery. Another is for patients with high risk for surgery or anesthesia. Don't forget the curative effect you achieve in fistula within 6 months in second-line treatment. Use Allium's app to navigate comfortably to your specific case. In malignant, use Allium URS in first-line treatment for patient with short prognosis or high risk for surgery, and for patients undergoing radiotherapy. As with Allium, you can continue radiotherapy immediately after stent implementation, instead of waiting weeks of recovery in the case of a surgery to remove the stricture. Of course, Allium URS is recommended in second-line treatment as well, in cases of reoccurrence of strictures and the appearance of ureteric fistula or rupture. Remember to use Allium URS and avoid several double J replacements that over a period of 3 years are much more costly than one Allium stent. Less results and worsening quality of life for the patients, especially when it comes to cancer patients. For BUS treatment algorithm is simple. You can deploy a BUS minutes after dilating or cutting the bulbar stricture with cold knife, for instance, and this way to avoid several repeated urethrotomies that will ruin the high chances for a curative effect for Allium BUS. Second option is after reoccurrence of stricture post-urethrotomy. In this case, avoid repeating another urethrotomy and put an Allium BUS. Third option is after reoccurrence of stricture post-arthroplasty. Allium BUS is the only good minimal invasive solution with up to 80% curative effect, and that can treat strictures smaller than 2 centimeters and also much longer than 2 centimeters. Talking about the only minimal invasive solution for patients, Allium RPS introduces the only minimal invasive alternative for patients with post-prostatectomy strictures in the bladder neck and also offer up to 80% curative effect. We welcome you to use our Allium app before, during, and after procedure for hyper-focused and relevant data to your procedure to the benefit of your patient. In this video context, you can also use the app for an interactive session with the treatment algorithm to better select your patients. Thank you for your active listening. I hope you learned a lot. This is Allium, engineered for excellence. Anything but mainstream.